it's a zero.
We make everything look good, including being overweight. So, scientifically, you cannot drink alkaline water and it makes your cells apolytic.
The closer you are to nature, the healthier you'll be.
All right. Happy Saturday, everyone. You are in the Mind of Nature, hosted by Dr. Zarif, the nutritionist. Good morning. Happy Saturday. We are live streaming on Facebook, we're on YouTube, and we are on Instagram. So as you are coming in, please go ahead and share the live so others can be a part of the conversation. I ran all the way over here just to make sure that I tell you all, thank you so much for joining us here today. We, again, are live streaming on Facebook, YouTube, and on Instagram. And we have a great show lined up for you today. The topics that we will be discussing today are preparing for terzepatide, all right, choosing a start date and a deadline. We have to have a start and an ending, all right, and psychology reality, all right. So, woo, Dr. Zarif, if you can go ahead and just meet me here on stage and we can get started.
I'm coming to the rescue. Hey,
Thank you.
that's true. Hey, everybody, it's great to be here today. I got one of my favorite brothers in the world here with us today again. And of course, we do this every third Saturday. I think, we it's just we're gonna be doing this on a regular basis instead of just once a month because I hear your different remarks about how you're enjoying the show. And definitely, we love it when Dr. James is here with us. So let's give it up, everybody. Dr. James in the house. Yeah. All right. We showed up. Let's let you care.
Like Arsenio Hall.
That's right.
Right.
Right. Yeah.
Thank you.
It's good to see you, Dr. James. How's it going?
It's going well on this last day of Black History Month. Going well.
Yes, that's when the 100th year. This is the 100th this year of celebrating our blackness, our Africanness, our whatever else those things categories. We are people that are global. We're everywhere, and we have so much to be proud of. I love that we've taken time to discuss some of the things that we've acquired, some of the things that we've achieved over the years. And it's wonderful to be in a culture that is proud of itself. So we know that we've definitely had our hand in many of the inventions that we use today. There's so many things that we don't know about us yet because those things were buried or they were drowned. Do you know whole cities of black people is underwater? And that's over the years. But I won't get you upset to start off with because instead of having a hot, have some hot cereal or something. Because I know it's hard to really, talk about these things. So we have incredible doctors like Dr. James Thompson is incredible. We are so fortunate to have him here. And that is definitely a huge plus for Mind of Nature. We also have the beautiful Carolyn Zarif is in the house, and I am so happy to be working with Care. Definitely, um, even this morning I was like testing 1 2 3. Hold on, here she comes. that it was good to have somebody to look to. So thank you, Care, for doing that. Let's talk about how do we get started. We're going to talk about these GLP-1s and what they are, and what are some of the things you can do to prepare yourself for them, and what does that entail. So we're going to do that. I'm going to go back to Care, and Care, if you have any shout outs like we usually do, let's do that now.
Oh, Of course. Well, I mean, let's see here. Michelle B is in the chat. Hello to you. Hello. Welcome, welcome. Anyone else that is here, or I haven't logged into Instagram yet, but I will right now. But if you are watching, thank you all so much. Go ahead and drop comments, questions if you have them, and we will be sure, or Dr. Zarif and Dr. James will be sure to answer them for you. Okay. But for right now, I think we are good as far as any shout outs, Doc.
Okay, well, let's go ahead and start with the understanding of what we're looking at. Dr. James, you want to take it here?
Sure. Thank you. And again, thank you for allowing me to be in this space with you, wonderful people. And I want to shout out personally to Michelle. Also, I know Michelle. We just communicated minutes ago, so I'm glad to see she tuned in. Um, so yes, we're going to be talking about GLP-1 agonists, and just to kind of set the table here, what are GLP-1 agonists? Well, first of all, the GLP-1 stands for glucagon-like peptide 1. And that's actually a hormone that the body makes. So these miracle drugs now that are called GLP-1 agonists, like Ozempic and Wegovy, tirzepatide, as mentioned, these medicines mimic the natural hormones that our body makes, but they're at a much higher dose, much more pharmacologic level in order to achieve what they're set out to achieve, and that is weight loss in this particular. But realize that this class of medicine first came about 20 years ago. I think about 2005 with the first GLP-1 agonist, and those that followed were primarily for managing diabetes, type 2 diabetes, because they could lower blood sugar. And so what happens is these GLP-1 agonists hit receptors that are in various places of the body, but specifically in diabetes, in the pancreas, they tend to promote more insulin secretion. They also, at the level of the gut, tend to slow what's called gastric means stomach emptying, and at the level of the brain, they tend to decrease the appetite. So this culminates in blood sugar lowering, and so that's been the primary use up until years after that, when it was noticed that, hey, these people are losing weight, significant weight. And so then they decided, I think 2017 might have been the first approved form of the GLP-1 agonist, is what's called a semaglutide. And initially, because it was so short acting, it had to be twice a day, but then they made some modifications. And now, fast forward, you can have weekly injection. Cepatide, as mentioned, is one that is approved for weight loss, as well as three others. But tirzepatide is for weekly use, and so they can, as I mentioned, the FDA has approved it for weight loss, and this class stands out because if you go back 40 years, the average amount of weight loss from various pharmaceuticals was about 9 pounds, maybe 5 to 9% of body weight. But this class actually is able to reduce your weight by 15 to up to 25% of your body weight. So that's better than anything in the last 4 decades as far as achieving that. But there are some risks, there's some downsides, and we're going to talk today about some pros and cons, some do's and don'ts. And so I'll pass it back to you, Dr. Zeddy.
Oh, thank you very much, Dr. James. This is a really some very good points that Dr. James made. That this is unlike any other resolution that has been used for quick weight loss. It also has proven to do things that are very important, or they're very, very helpful to the human body. And that's some of the things, just like, your people that have had a lot of weight on maybe a weak joints. They had obesity pretty much doubled. Anything that you have at that and obesity is a bad combination. Some of the things, the GLP-1s really are doing now is helping to improve like insulin sensitivity, and that's is just a crucial, is very necessary for metabolic health. And then insulin sensitivity actually refers to how effectively the body cells respond to insulin, which is a hormone that regulates the blood sugar levels. And you've heard us talk about that over and over, especially when we talk about diabetes. Furthermore, enhancing the insulin sensitivity that can help to reduce the risk of type 2 diabetes and other metabolic disorders. Um, the digestive system is definitely a huge part of what we're talking about. But some of the things that we'll get in as we continue to talk here later on, we want to also talk about what can you do as an individual to just do some of the basic things that are required for you to be as healthy as you can. Another thing the GLP-1s will, I would say, would be a pro would be reducing the appetite. Many people ask, like, what vitamin reduces appetite? Because they hope that they can get a single pill, or this is how they thought in the past, getting a single pill, a pill that heals everything, and that will actually quiet persistent hunger. And that's a big problem even today. People feel like there are those people that feel like they have to eat all through the day. That's all they do is snack and eat meals through the entire day without any type of structure or plan about the way that they should eat. And when I say should eat, in order to expect really a positive and strong, I don't know if I mean strong, but healthy results, is to understand that there is a fee that we pay for that too, and that is just simply just exercising, making sure that we are doing things that eating healthy foods, making sure we get in deep sleep, and having a great environment. All of these are very important parts of being a very healthy individual. Now, here in the mind of nature, we're going to unpack some of the best human evidence on vitamin B, vitamin B12, zinc, chromium, and iron, explaining when supplements help, mainly by correcting deficiencies. And it offers practical, science backed steps to manage the appetite safely. Now, I'm getting some feedback a little bit for some reason. I don't know if you all hear that too. Let me see. I'll turn 1, 2, 3. Okay, I think that might have done it. Okay, all right. Some of the things that we've been talking about should be able for you to put these things in order. Well, let me just stop for a minute because it's really kind of irritating me. Can you all hear that, Dr. James? Do you hear what I hear?
Everything's clear here.
Okay. Yeah. Okay. Yes. Okay. All right. Okay. So, all right, beautiful. All right, let's go ahead and move on. The another thing that would be a pro, and I think Dr. James also brought this up too, is the reducing the post-meal glucose spikes, and that's when your sugar spikes after eating a meal. And if you have diabetes now, you may find that it is harder to manage your blood sugar, also called glucose, around mealtime. Now, when you're done with the meal or you're done with the snack, your blood sugar will be higher, and it may stay higher even a couple of hours after your meal. So you may feel a little dizziness for some people that are very sensitive to sugar, or have a hard time thinking or focusing. Even sometimes people's vision blurs. or we feel really tired or thirsty. Now, you may have a headache too, because some people are very sensitive to glucose or high glucose spiking, and they can experience a headache from that. Extremely high blood sugar can even make you pass out. Like if you for instance, if you have postural vertigo, and it's easy if you are fighting it, and instead of sitting down or being still, or working on some of the exercises that you've been suggested to do, and you want to get up and walk, and I got this, and you fall out. This can be really dangerous, because you can fall on something that can cut you, or you can hit your head and make the situation worse. So it's really important that we get this information in so that we can learn to work with it. And yes, the right medication and then diet, all of that can help you make sure that your blood sugar stays under control. So there are medications that can help you with that, but that's not the only thing that you can do. And that's what we'll be talking about today. We know that now, looking at the different medicines that are on that are open to us or access to us, are they help to significantly reduce body weight, and that's what we've been fighting for the longest. Fighting your body weight with some of the natural things like the vegetables and fruits and all that. They have a place, and it works wonderfully, but to significantly reduce your body weight can lead to numerous health benefits, and losing a substantial amount of weight, typically defined as 5 to 10% of the total weight. And you can improve your overall health and reduce the risk of various diseases. And so, in other words, if you have uh, your weight under control, if you have your weight under control, you can also put under control a lot of other illnesses, and fight against infection and disease. Cardiovascular health, that's one of the things that I talked about in Dr. James' program this last month. We started, and we talked about the different ways to have better cardiovascular health, and that's heart health. And that was really wonderful. If those of you that got a chance to listen to it, please adhere to those things that we shared with you, because they are proven to help you to manage your weight, and you can lose weight significantly, and it can also enhance your cardiovascular risk factors, such as blood pressure and your cholesterol levels. So when you hear this information, we're not here to entertain you. We're here to get you to take action. A few more things to keep in mind, like there's also metabolic benefits. Even the modest weight loss can lead to improvements in insulin sensitivity and blood sugar. Sustainable weight loss, not the yo-yoing that we've known in the past. A gradual weight loss, about 1 to 2 pounds per week, is more like more likely to be maintained over time. And incorporating a balanced diet and regular physical activity. I know you hear that a lot, but this is something that is super important to have effective weight loss management. You're going to have a lot of other challenges like with anything else, but the body is biologically wired to resist weight loss. It's wired to resist weight loss, making it a challenging process. And lastly, the psychological factors and lifestyle habits also play a significant role in weight loss success. So the way you think, what you believe in, what your habits over time, all of these play a big part in managing or your weight. And managing your weight, as you see, is not just like stop eating so much. It's not just that. It's a combination of things. Okay, so I'm going to go back now to Dr. James, and we'll hear from Dr. James, and then we'll go back to care. All right.
Okay, great setup.
Thank you.
Yes, I think that the GLP-1 agonists are here to stay. They this This is not a biased presentation from Dr. Zarif and myself. This is just to provide information. I
Yeah.
realize there are a lot of people that are on these medications now in one form or another and likely benefiting from them. The cardiologist that was on the 28-day Kickstart program that Dr. Zarif mentioned was really supportive of using these medications for controlling weight and reducing weight. But as Dr. Zarif said, not only that. That's the important thing is if you do only that, it's kind of like having high blood pressure and getting on a blood pressure medicine that reduces your blood pressure, but then you keep eating a lot of salty processed foods and things and foods that elevate your blood pressure and perhaps not regularly exercising and not getting proper sleep. In fact, some people feel somewhat licensed to go on to do what they were doing, perhaps even indulging a little more with things that are not so healthy to eat because they're on medication for their blood pressure. So I use that as an example with these medications now that can so successfully reduce weight. You don't want to you don't want to keep doing the same things you were doing that got you there. So you want to have a plan, and Dr. Zarif often mentions, if you don't have a plan, you will likely fail. So you want to have a plan. And so that plan is if you are on these medicines, if you're thinking about asking your doctor to be on one of these medicines to lose weight for no reason, because obesity is associated with a ton of different diseases, not the least of which, is diabetes and can vary about 15 different cancers and bone and joint problems and depression and anxiety. So it's worth it to consider something like this, but don't consider it an easy button because if you only do that and you don't make these lifestyle changes and make better food choices like Dr. Zarif mentioned, eventually the well is going to run dry in different ways. One, you don't have further increase significantly of pounds after 1 year. I don't know if your doctor will tell you that or has told you that if you're on it, that it levels off. In the studies, the multiple studies that are out there, you stop losing that weight after about a year. Two, about 50% of people after 2 or 3 months stop it for one reason or another. It's very common to have nausea, it's very common to have diarrhea. It's very common to have some stomach discomfort. So for that reason, about almost half the people are off within months. And if you look at data going back 1 or 2 years, you're talking about more than 75% of people have stopped. So if you haven't done those other things Dr. Zarif has mentioned, you can rebound. And that means you can bounce back to not only sometimes where you were, but even worse. Because sometimes those hormones that are suppressed that govern whether you're hungry or full, they've been suppressed for months. And then now you get off for whatever reason, maybe side effects, maybe your insurance runs out. And now those hormones come back with a vengeance. You're hungry. They call it food noise. People often have more food noise after these medicines for whatever reason are stopped. So it's real important to acknowledge that, have an exit plan. Don't plan on this being something lifelong. If you make no other changes, it will have to be lifelong. And again, you'll be at the potential risk factors of long-term risk factors, which are still not known since these at this level, these medicines haven't been out for more than 10 years. So we often don't find until after 10 years what long-term risk factors. And you may be confused. Okay, well, didn't you say in the early 2000 these first came out? Well, it came out for diabetes, but it's only been within the last 10 years that it's been used at higher doses to reduce weight, and new formulations have come out. We don't know what the long-term effects may be. We know there's some rare serious effects that can affect your pancreas, pancreatitis, your gallbladder, your eyes. So we know that that road is still being paved. That's why it's important to take this seriously and realize that this is a short-term intervention. Your long-term intervention should be lifestyle changes and and better dietary choices. Dr. Z.
Yes, that's wonderful, Dr. James. Thank you very much. Some of the things that I think in what you just heard makes sense if we do a little more finding out. Your your due diligence, because as Dr. James just very clearly stated, is that it is important for you to understand how to use these drugs, because sometimes they're new, they haven't been on the market a long time. And speaking of market, you can save yourself a whole lot of money if you were to just take a little more time, a little more study, a little more shopping, a little more reading the labels. All of these things are important. On top of that, medical preparation is super important. Like before you even take that first dose, some of the things that you should have evaluated would be your hemoglobin A1C, fasting glucose, your fasting insulin, your CMP, and that is testing on your liver and your kidney function. Then your lipid panel, there's thyroid panel, there's vitamin B12, the same thing as cyanocobalamin, and vitamin D, your baseline weight or your waist circumference. We went over that a few shows ago, and we talked about like a male or a grown man should not exceed 44 inches in his waist. Now, there's an exception to this with like, huge people, but I'm talking about basically and generally people that are not the size of pro basketball players or football players and so forth. But it is important for you to keep that waistline. Men 44 inches, anything over 44 inches can increase your risk of disease and infection. And then for women, we're talking about the same waist, but you want to be 40 or less. Keep it under 40 inches in your circumference, and you'll find that that also, and I'm talking about these are studies, not just, my auntie and my grandmother did it. This is something that definitely can be um, used in cases of most people. So please pay attention to that. Other things that medical preparation include would be a history of pancreatitis, severe gastroparesis, and then a few other things. That's enough for you to at least get it started, and you'll find out that you'll be glad you did. To prepare your gut. Now, this is I love hearing Dr. James talk about this subject, gut health. We've talked about this many times and how important it is. Most side effects are gastrointestinal, as I stated earlier. Like we have about 9 out of every 10 people have some kind of digestive disorder. That's because we are eating out of order, and we should pay more attention to that. And this would also reduce illness. So that pill or that syringe or that what dose of the GLP-1, those things, yes, they do work, but they do not substitute your responsibility of taking care of yourself. You preparing your gut, for instance, which is very important because they get a lot of these side effects come in the form of nausea, constipation, reflux. You have bloating, and 2 to 3 weeks before starting, some of the things you can do is increase your water intake. We talk about water constantly, and this is a balance, not overdoing it, but making sure that you're getting a minimum of 80 to about 100 ounces daily unless medically restricted. Then gradually, increase your fiber. Don't spike it suddenly. Just little by little, add more and more fiber to and that's your vegetables. That's a cruciferous vegetables and fruit, different colors, and eating the peel on some of those, and making sure that you get fresh vegetables and fruits, and in a salad, for instance. When I say raw, sometimes some people think that I'm talking about like raw tuna or raw seafood. It's not. I am talking about those plant-based foods that will help us to avoid or to increase the protection, or I said the other way, to reduce the risk of disease. You're only going to do one or two things. You're going to either increase the risk of disease, or you're going to decrease the risk of disease. Okay, it's no neutral. Neutral is not doing anything. So it's just being indifferent. I'm talking about taking action. Okay. All right. So right here, we're going to take a break. We're going to go to the wonderful Carolyn, and we'll be back with more.
Thank you so much for that, Dr. Zarif. I appreciate it. Got to get those buttons going. Thank you so much, everyone. Thank you for joining us here in the Mind of Nature. We are live streaming on Facebook, we're on YouTube, and we are on Instagram. Thank you all so much. Go ahead and share. Yolanda, you have been sharing, and I so much appreciate that. Every time I see a comment, it's a share. It's a share. And I appreciate you so much for sharing and just letting us know that you are there and supporting. And I appreciate that so much. Not Your Average Joe podcast. Hello, welcome in, welcome in. Thank you for joining us here today. We really do appreciate you. So let me make sure I get it right. Eclipse Soleil over on Instagram. Hello, welcome, welcome. Thank you so much for joining us here today. We really do appreciate it. And Darcel, I see you in the comments as well. I'm just trying to get to it, but I remember seeing you. There you are. Hello, hello. Welcome in, welcome in. Thank you so much for joining us here today. We appreciate everyone that likes, shares, comments. Just let us know that you're there. If you have any questions for Dr. Zarif, and for Dr. James Thompson, go ahead and drop those in the comments as well. We've been talking about GLP-1s. For anyone that doesn't know, it's like the Ozempic, Wegovy, those, kind of drugs, the weight loss drugs, or the drugs that are now being used for weight loss, right? So go ahead and be a part of the conversation. Drop your comments, and we will get to them, okay? Dr. Zarif and Dr. James, I'm going to throw it on back to you guys.
Thank you very much, Carolyn. One of the things too that I wanted to talk about, and Dr. James reminded me of this too, is the plan. You hear me say that a lot. If you don't have a plan, you're just you have a plan either way it go. If you don't plan, if you don't arrange or organize the different goals or the different responsibilities in achieving a goal, then you are planning to fail. People don't do things successfully by accident. People don't get healthy by accident. People are doing these things because they're planning. Some of the things that you can plan, before starting, these are super important. One thing is to work with your doctor and get a protein target. How much protein you should have for a lean body mass, and then you want to have smaller and slower meals. Eating them eat slower, and definitely you can change the size of your plates, and don't put some people make something in a pot and then they put that on the table and eat straight from the pot. It's just, that's usually people that live by themselves, and they don't, but treat yourself like you would treat a guest. You need to make sure that you're eating in smaller flatware and dishes, that it really helps you though it triggers not eating so much. Eating slowly, you'll get definitely fast. You'll be full faster when you eat slowly. And stop before you're stuffed. It's super important to know. Stop before you're stuffed. Stop before you're stuffed. And most people, so a lot of people want to feel that kind of tightness in the stomach. It's also important for us to pay attention to our muscle mass and remember in plant-based diets or lifestyles, we get plenty of protein from our plants, the edible plants. Very, very important to keep in mind. Rapid weight loss can reduce lean mass, and that is a part of the weight loss. Now, I honestly have not, those people that appear that they've been on GLP-1s, they don't, to me, and I have to be honest about it, they don't look like they're uh, overdoing it. However, as I mentioned before, I was looking at many people that we know they're very famous, and they look like they were drained and not balanced, and that they use excess medication. And this is what I really warn everybody about, making sure that you don't overdo it. You don't overdo it. Start resistant training now. If you're planning on getting on that, make sure that you're taking 2 to 4 times a week. You want to do some strength training. Then you have body weight or light weights are really fine, but just really work. You can have guys, yeah, even the guys, you can take 10 pounds and get a great workout in both hands. You don't have to get these heavy weights, especially when you're 50 and over, unless you've been doing this all of your life and you're used to it. But even then, the reduction of weight, because your body does change over time. Our body was not created to last 1,000 years, despite what you may have heard. That hasn't happened, and most likely it won't happen. We are not created to live that long. Another thing is to prioritize your legs, your back, and your core, along with other muscle preservation. When you preserve your muscles, that equals metabolic protection. And all of these things, as you see, it's a combination of things, not just one thing. It's a combination of things, not just GLP-1, but there's a combination of things in order to maintain that look, that feel, and the success of that quick weight loss. Dr. James?
Yeah, I couldn't agree more. It is so important to not only eat healthy, continue to eat healthy, and if you're not eating as healthy as you should, eat healthier while you're on, whether you're on the GLP-1 agonist or not, but especially if you're on it, because if you do have to stop it, if the well runs dry, you want to have your body and mind prepared for it. I realize it's sometimes easier to grasp this when you understand the why or the how. The reason why it's important to exercise, I think some of you that are aware of these drugs know that there's been some terms, Ozempic butt and Ozempic face. This kind of, people lose weight rapidly with these pharmaceuticals, and their face kind of droops a little bit in terms of the extra skin, less fat, or their butt is not as firm, and they call it Ozempic butt, and they get dimples and things like that. And what happens is that if you rely just on these medications and you don't have adequate intake of nutrition and you don't do these exercises, Dr. Zarif has mentioned, then you're at more risk for this type of a scenario. Realize that when you take these GLP-1 agonists, you're not just losing fat, you're losing some lean body mass too, proportionally more than when you just do diet and exercise to lose weight. So that's another kind of cost to this type of approach, but it's not defeating. You still will lose that weight, but remember, it's limited. After a year, it's almost insignificant. And to continue, you'd have to continue the medication. But you may not have to continue the medication if you are doing these other things, the exercises mentioned, the slower eating of food. It just so happens, Dr. Michael Greger, within the last week or so, or maybe in the last 6 months, I would say, mentioned that you can do some other things to reduce your need for GLP-1 agonists. That includes slower eating, chewing your food more. They have studies that show that you take in less calories and you tend to proportionally lose more weight when you slow down your eating by chewing more. And Dr. Zarif also mentioned about not eating till you're full. I'm so glad he mentioned that. The Japanese have a term for that called harahachi bu. So, and that means eating till you're 80% full. And the Japanese, up until McDonald's and Burger King invaded Japan, they were pretty thin people because they were constantly moving. They wouldn't eat to their full. They had small portion meals that they would eat slowly. And so these are all important things that do add up to success. So maybe not require these GLP-1 agonists, or to perhaps not require them as long. Because remember, the benefit is limited in terms of progress. After a year, you've gotten out of it most of what you're going to get. So at a year's time, let's have those lifestyle and diet changes in place so you can come off of the medicine. It often needs to be tapered so you don't suffer some of those rebound effects of being off the medication. Okay,
God, that's excellent. Wow, that's excellent, man. That's good. I want look. If you're in the audience this morning, we really thank you. 'Cause again, the information that you're getting from Dr. James, myself, and even Carolyn, everybody can learn from each other. And I am just really so. Thank you, Dr. James. If you have to pardon me if I say thank you 3 or 4 more times for me.
thank you.
Really wonderful. And I really feel that, some of the things that we talked about, some of the good things, the ups or the pros. I'm going to talk a little bit about the cons a little bit because we need to prepare for the side effects, and most things over time have side effects. Some of the common early side effects are nausea, becoming nauseous, the fatigue, constipation, and some of the helpful tools that you hear. I know for me, because it's one of my favorite, ginger tea, one of the best anti-spasmodics on the planet. And you also have capsules now that are made with even more plant-based material now, not the one that had some of the ingredients that we don't want in our diet. Electrolytes, understanding, electrolytes is another helpful tool. Magnesium glycinate, for instance, and magnesium glycinate is good if you are constipation prone. Then you have a smaller meal portions, as I said earlier, and avoid lying down right after eating. This is like for people that have the uh, uh, acid reflux, or it's also called GERD. When you eat and you're like, and you kick up your feet and you push your chair all the way down like you got a recliner. And no, that's not the thing. The thing you want to do, eat, you can be still a little while, but even if you got up washing dishes or cleaning or rearranging something, making up the bed, back in the backyard, walking around in a or a park if you're lucky enough to be close to one, or if you're in a great neighborhood to walk, but get some kind of action. Just don't go to sleep after you eat a good meal. You want to also keep in mind some of the emotional preparation. Now, the medication changes your appetite signals. Some people experience reduced food noise. Dr. James talked about that earlier. Your food, the food noise, emotional shifts around eating. Um, and you know that that's sometimes you can eat food that gives you that energy. Let's get them, and then you have the other food that just will allow you to or give you the nutrients that will relax you. These are some of the benefits of those foods that they're also calming. And identify adjustments. So your identity adjustments, they're very important, especially when you're eating something and you are aware of how connects or how it makes you more comfortable, or is it these different foods seen as comfort or reward or stress release, uh, and you want the non-food coping strategies ready, and that's because it's real. Don't just jump into it and say I'm cured, I got everything I need. It's not like that. Start low and go slow. This is a way that you can help. Don't rush the dose escalation, and you talk to your doctor about dose escalations and also down titrations, so that you will know what to expect and what to do to help your body. So the other thing that's really important too, as far as the downsides, is realize that the GLP-1s is actually a tool. It's a tool. It's not a replacement. So you again remain or retain focus on those foods that are like whole food eating, sleep hygiene, movement, stress regulation, and it works best in synergy with the metabolic alignment. So the way that you eat, when you eat it, how much you eat it, all of these are combinations of eating in a way that will keep you healthy, not just jumping on the bandwagon because everybody's getting little. That may not work for you. You might be one of the persons that it doesn't work for. But if you are going that way, make sure that you are aware of, again, the emotional preparation, the dosing mindset, um, the lifestyle work that goes along with what you've chosen, how you're choosing to eat, and then watch for the warning signs like severe abdominal pain. This is when you contact your provider, by the way. Persistent vomiting and signs of pancreatitis and severe dehydration. These are some of the warning signs. Okay. So, Kara, do we have any questions, any comments?
Yes, yes, there are. I was going through the comments. There are a few of them here. Let's see, just starting off with Yolanda. Um, saying, wow, I've lost 100 pounds in car accident and a few falls. Uh, lost a lot of muscle. I'm trying to get back. Um, so just a few comments that we have here. And there's a few comments also from Michelle B. Um, I wanted to get to, let me get to those right now. Excuse me. It says here, or she says here, if you are having surgery, remember to alert anesthesia, your anesthesia provider and surgeon. Most facilities will ask you to stop your dose a week prior to your surgery. Okay. Thank you so much for that information. Let me see here. Something else that was added to the comment. This is common practice as it increases the risk for respiratory lung issues. These are the extra instructions I give patients along with stopping the dose a week prior. Thank you so much for that. Let me see. There are other comments here. One, stop eating about 1800, 6 p.m. the day before surgery. Two, the day before surgery, only consume liquids, like a liquid diet. And 3, on the day before surgery, try to drink broth and clear liquids. Okay.
Now, I wanted to add something to that, Carolyn.
Yes.
People, while we're listening to this, make sure that you know or ask your doctor how long can you take it. You got to have a goal. You know what, and know what is that goal. You know, and what is the exit strategy. So not only know when you're going to start and know when, okay, I'm going to do this for how long, and understand your exit strategy. Really important. Thank you, Karen.
Absolutely. And in addition to those other comments, this is from Michelle B. She says, remember, this is facility specific, and some facilities will have different protocols. However, this is the standard of practice and very common in the majority of surgeries. Okay.
Absolutely. Thank you very much for that. That's well said. Um,
And let me see, there is one, excuse me. Um, oh, this was a comment I posted for a friend, nurse anesthesia
and
Anesthetist. Anesthetist.
anesthetist who is on the now. Okay, thank you. In the know, I believe it was. All right, thank you so much. Well, I'm just seeing the comments, but thank you so much for that, Michelle B, for sharing that information with us, and also other comments in regards to. Let me see. There was something else from Yolanda. Oh, let me see here. After 60, you lose a lot of muscle, unlike in your 20s. So that was a comment that she wanted to go ahead and add to the conversation, and I appreciate that. Um, Also, up at the top, it says, she says, Yolanda Rogers, I go to the gym and do the majority of my workout in the water. It's less on my joints.
Now, that's a very good. Thank you very, thank you very much, Yolanda. Those are really good points. One of the things I want you to keep in mind that yes, sure, if we become sarcopenic or we're not moving around as we get older, yes, the muscles will reduce because we're sending the message to the body that we don't need that muscle anymore. But if you exercise, and even in the water, there are weights that you can use in the aquatic aerobics or your aquatic exercise. Get those weights and use those muscles, biceps, triceps, your quadriceps. Use those muscles, and those muscles will, you can retain the toning of the muscle. And when you don't do that, then we have that kind of droopy look. And also, out of the water, like walking and just simple walking, even if you are walking with, if you have like a maybe one of those, not the cane, but the, what is that? Thing is like you put both of your hands on the side, like when you're walking, like
Yeah,
older.
yeah, that walker. Yeah.
Yeah, the walker. That walker is also a tool. If you look at it, you can do dips on that thing. You can lean forward and use your arms. You can also put that in front of a chair and use it by raising up one leg at a time, touching it, and then back off the side, and then doing the same thing on the other side. Look, you can become creative.
Mhm.
It's very, very important to know that you can become creative, and you don't have to, just because you're getting older, meaning that you know you don't have to be old. Older, that er is a real powerful suffix, and you want to think of it as being stronger. You want to think it has been think of it as being wiser. You want to and being fit, fitter. It was, you know, it doesn't work there, but it's definitely, you know, that you do have all the way up until it's time to exit this earth. There's always room for improvement.
Absolutely. There is a question in the comments from Darcel says here, any recommendations on a healthy protein shake brand?
Uh, even if I did, I wouldn't even mention it because they're not supporting our show. But I would tell you that there are a lot of from everything from your different seeds. There's different legumes. The bean family legumes, people really miss how great black beans, black eyed peas, lentils, green peas, great northern beans, white beans, all of those different types of beans, they are packed with protein. Now, I think that always think that everything that I hear isn't all that there is to hear. In other words, when I hear about a certain bean or I hear about a certain nut, I don't think of it as I know all that I need to know about that. So you do your own exploration and it really, really helps you tremendously. Some of the things that also have like your soy, there's barley, millet, there's brown rice, and then there's a host of vegetables that you can also get your protein. Even chia, I mean, chia seeds have a great source of protein. So I would say look those things up, search them, and then find out where you can fit them in your lifestyle. And thank you also for the comment.
Absolutely. I'm just looking through, and I believe um, that's it. If you want to,
Okay.
yes.
All right. Very good. Very good. Okay. So well, let's go now. We have a few minutes left, and we're gonna give these few minutes to Dr. James to go into whatever you like. Thank you very much for like always bringing the heat. That's beautiful. So Dr. James, the floor is yours.
Well, thank you. This is, I think we've gotten a lot done in this quick hour.
Yeah.
I'll just harken back to the expectation of GLP-1. People, the marketing tends to, I think, give people a false expectation that, okay, you get on this and you're going to get trim and fit and you're going to go from obese to to whatever they consider the norms of your body mass index or your weight. And that is false marketing, because in these studies, which there are quite a few of them now, people do lose weight, which is important for your cardiac risk factors and other risk factors we mentioned in terms of your metabolism, your risk factor for type 2 diabetes. But when you lose, if you're say 220, 230 pounds, maybe 5'4", 5'5", and you lose, 20 or 30 pounds, that hasn't made you go to not being obese. That has not eliminated your obesity. You've lost weight, which is a great thing. And no one needs to be, skin and bones, of course, but you still have some significant risk, because if your BMI is still over 30, you're still at risk, although lower, from many of the diseases we're talking about.
Yeah.
So the reason why I mention that is again, it's the underpinning of the recommendation that you not just rely on GLP-1 agonists, and that you consider, even before going that direction, the lifestyle and diet changes, because they can be effective without the risks. The risks that Dr. Zarif has mentioned, long term and short, the short term stomach risks, the long term organ risks, with pancreas, possibly gallbladder, possibly liver, possibly eyes. So those are important things to keep in mind, because most people that respond to these medicines, there is a limited response. And as Dr. Zarif mentioned, there's about 10 to 20% of people that don't respond. So
Yeah.
that's why planning lifestyle changes in parallel or preceding this is so important. Dr. Zarif has been in bariatric medicine for a long time, and he knows that people that have surgery often are challenged first to change, make some diet and lifestyle changes before going to surgery. And sometimes these people end up not requiring surgery.
Yeah.
So, so having that kind of initiative, that kind of support system, the kind of resources you can get here on Dr. Zarif's show is what can get you there. So thank you.
Thank you so much. Wow, man, we were just so blessed. So let's talk about a little. Just before you go, Dr. James, you got a book out right now. You're doing things. You're going places. You're helping more and more people. What's the name of your book, and what is in it?
Yeah, well, I think we both have our books. I see on the site there. Yeah.
Yes, yes.
Mine is a health guide, Fearless Wellness. It's not a vegan book. It's a book that to just improve, to make progress, and by eating more plants, by eating less foods that are not as healthy, and by looking at it from a holistic standpoint, also taking into consideration the food that's not on the plate, but yet is nutrition, and the what things we've talked about, rest, proper rest, social energy, spiritual connectivity, purpose, and all these other things like interacting with other people. All these things are really important. And that's why I'm involved with this, with people like you, Dr. Zarif and Carolyn, because I'm interacting with people with a purpose behind it. And it's a type of social interaction. It increases some hormones that make me healthier, decreases some more hormones like cortisol that tends to be high in levels of stress. So I think it's really a symbiotic type thing. So I appreciate that.
Beautiful. Thank you very much, Dr. James. And we have Carolyn. You want to come on? Come on up. Good. There
Yeah.
you are. Carolyn, what are you doing now? And I know people want to know. I know when we go places there, oh, I saw you on the show and I was looking, especially the ladies, they're really excited because you give them a woman's point of view. What would you like to add? And what are you doing? Do you have other things that you want people to know about Carolyn?
Yes, I mean, as far as switching over or starting a new way of eating, there's always going to be cravings. There's always going to be the wanting to, go and eat the certain thing that you used to eat before. Just understanding that there are replacements for it. It may not be the full replacement. Like, let's say, for instance, fish. That's one of those things that, like Good Friday, my mom would always she would always cook fish, and that was just what I was used to growing up. But since I'm not able to do that, I would do or add things like seaweed, just something as simple as seaweed, and it gives me that taste and that like fulfillment. Okay, I have that taste of fish that I used to have that I, was no longer able to have. So
Right.
just understand the cravings, they're going to be there. But just find things that can replace it and come as close to it, and not take you off track from that decision that you made to be healthier.
That, woo, I loved it. That's what I'm talking about. Thank you very much, Carolyn. That was awesome. Everybody, thank you out there from those people that are here on Instagram, and we have YouTube and also Facebook. We really appreciate you checking us out. Now, spread the word because we need your followership in order to expand. Please also let people know our names and where we're here at 8 a.m. every Saturday. We're not here just for our health. We're here for all of our health. So thank you very much, everybody, for being here. And this has been The Mind of Nature. I'm Dr. Zarif, the nutritionist.